Happy New Year, everybody. We made it to another year. It's the perfect time to plan, to get organized, and to make those atomic habits and put them towards your health plan. So, here are a few ideas. Here are some things that you guys can do to get yourself and set up your family for success in 2025. Number one would be familiarize yourself with the plan documents. So, now is a great time to go ahead and actually connect and pull up your plan documents that you received for your plan this year. One of the reasons you want to do that is you want to be able to see what is in there. You actually want to review it and see, do you have any holes in your coverage? Is there anything that's particularly expensive? Are there really expensive copays, co-insurance? Are there any out-of-network costs you need to be aware of? Now is the time to read through those summary of benefits that you get and actually make sure that you understand everything that's in there. So the number two tip is to know your deductibles. So quickly, let's define a couple of terms. A premium is the monthly payment that you make each month for your health insurance. A deductible is the first dollar requirement that you must pay before that insurance kicks in, unless it's specifically mentioned for certain copays where the deductible doesn't apply. It says, deductible waived, something in the plan. So knowing your deductible is important because that gives you a savings goal for which you should have on hand for yourself or your family in case of some kind of an emergency, because that's going to be that first dollar requirement that you're going to end up needing to pay. So the number 3 tip, followed shortly behind that one, is understand your out-of-pocket max. An out-of-pocket max is the max liability that you could potentially have in your plan. This number is the absolute worst case scenario where you cannot be charged any higher for your annual cost. This number includes your deductible. It includes copays, co-insurance, any other costs that you may pay each year. So one helpful tip is to keep a record of all the expenses that you have paid through medical treatment throughout the year. So this will give you a record which you can use to dispute your out-of-pocket max in case there's any pushback from the carrier. So if you have any sort of issue, you can actually point them back to the paper trail and say, hey, this is actually what I paid this year, and be able to prove it if you end up having to go through that route. So tip number 4 is look up your doctors. So it's a new year, you're potentially on a new plan. This means that you are probably not 100% confident if your doctors are in network on your current plan. So you're going to want to verify using, there's usually a find your doctor or find a doctor button somewhere on the carrier's website. Another good way is just to call your doctor. Sometimes that's the better way because those maps and those contracts, they're fluid. So just because it was true a year ago doesn't necessarily mean it's true today. But if you call your doctor's office, they will be able to give you the answer because they're the ones making that call if they accept your insurance or not. And it's also good to call your doctor because if they say no, you can always ask them to reach out on your behalf to see if they will be able to accept that insurance, that they will be able to set up some sort of contract to be able to use it. So it's rare that doctors don't want to get paid and they really don't want to lose a client. So if you can go ahead and let them know ahead of time and give them some advance notice, they may be able to actually make a deal with your insurance carrier so you don't necessarily have to go find a new doctor. I guess a little side tip there too. If we're talking about primary care doctors, a handful of your kind of like normal exams, if you really love that doctor, don't bend over backwards to try to make the insurance thing work. You can always just show up and pay cash. Chances are it's cheaper than going through your insurance anyway. So just show up, be willing to pay cash. It wouldn't be that expensive, especially if you're just there for some sort of annual exam just to get checked out. Tip number 5. This one actually, I believe is really important. So tip number 5 is find a 24/7 urgent care. The most common problem that I see is people going to the ER when they shouldn't be going to the ER. So an ER has its place in the hierarchy of care, but it should be one of the last resort options for you. The preferred option So if we're going to talk about a hierarchy and how you want to think through how should I deal with my problem, your first tier should be to look at 24/7 telemedicine. So you can reach out to a doctor, you can receive immediate attention. This is because most of the time we're talking about a sniffle, a fever, some flu-like symptoms. Most of the time, that could all be taken care of with a quick call on telemedicine. It means you don't need to leave your house. Usually that's free. If not, it's a very minor fee to use your telemedicine. You don't have to go anywhere. You don't need to get in the car, and you don't need to be in a immune compromised position and showing up inside of some doctor's office with a billion other people where you could get something worse than what you actually came in for. So step one is try to deal with this with telemedicine. Next step is if you can't do that, try to set up an appointment with your doctor, your primary care doctor. They will be able to give you the best advice moving forward of what you should do. If it's more severe than that, say you can't wait, a couple days to go in to see your doctor, this is why you should have a 24/7 urgent care, because you should end up going to the urgent care before you ever step a foot into an ER. So 24/7 urgent cares are becoming more popular, especially in more major metros. You can usually find some sort of 24/7 urgent care, but you might be asking why. Well, here's why. An urgent care and an ER are billed very, very differently. An ER is going to cost you a lot more money. So an urgent care will normally run you about $25 to $50. That's usually like what your urgent care copay would be. An ER visit, on the other hand, could be 250, 300 plus dollars to go visit the ER. And chances are, if you go to the ER and it wasn't an emergency, your insurance may not even cover it if you show up to the ER. And this becomes very complicated as we care about our loved ones, we care about what's happening. It is common that we quickly jump to the extremes and make it a very serious deal when it may not be, which again is why I say check telemedicine first. They may be able to calm you down, let you know, or tell you go to the ER. The other risk with going to the ER is you may be covered from the ER as a location. You may not be covered for the doctors that are inside the ER. And the problem is you probably won't know until after the fact, right? The ER exists for truly an emergency. If it is a life or death situation, right? If you're bleeding out and like you need to get there, go to the ER. But if it's a sickness, you got a fever, I don't know, you feel weird, you might have a random pain, but like it's manageable. Either wait for your primary care the next day, go to urgent care if you have one of those. You really should reserve ER for truly an emergency. That's what it's really there for. Tip number 6. This kind of piggybacks off that hierarchy of care we just talked about, but download your telemedicine app. Almost all health plans these days come with telemedicine. It is super, super rare that it doesn't exist within your plan, whether you're on a Medishare, whether you're on some sort of really any insurance plan, you have access to telemedicine. If you're uninsured, it's really cheap to get telemedicine. So that would be another tip. If you're uninsured and you don't have any, at least get this. This should help a lot. Telemedicine, most concerns with the flu, colds, a rash, a fever, lots of other minor things. Most of those things can all be addressed through telemedicine. So when it's late at night, you don't know where to go, start with telemedicine. 99% of issues can be taken care of there, including getting prescription if it's necessary. Most of the time, these doctors can actually provide you a prescription for some sort of medicine right there over the phone and send it to your pharmacy. So you don't even have to step foot inside a doctor's office. You can talk to them and then just go straight to CVS or Walgreens or wherever it is you get your prescriptions from. But it's also very easy, with our loved ones, we want to have somebody to go to. And it's very jarring to wake up and have to deal with a high crisis situation at 2 a.m. in the morning. It's always good just to give a quick call to figure out if it's something urgent that you really need to take care of, that you need to go to the ER, if you can go to a 24/7 urgent care instead of that ER, or if it can just wait till the morning. Tip number 7, know who to call. So I am a huge advocate of having a healthcare advocate. So an advocacy line or a company that will help you navigate kind of the complexities of health insurance. These individuals, they understand your plan documents, they have access to resources where they can verify the quality of care of doctors and hospitals. These are things that most normal people don't know. You don't know what the ratings are of the surgeons down the street. You don't know the amount of repeat medical treatments that have been happening at that hospital, but a healthcare advocate does. So these folks, they can help you make the most informed decision so you can receive the quality of care and best outcome for your dollar. Lastly, this advocacy team can also assist you with finding a doctor and billing issues. So if you believe that there's an error on your bill, reach out to an advocacy team so they can assist you and even negotiate your bill on your behalf. So this is one thing, figure out who this is on your plan and save your number. A healthcare advocate is a lifesaver. It just gives you a great first step in knowing who it is that you should call. So tip number 8, create a family how-to plan. So a family plan is something that every household should have. It's a game plan for how you're going to enter into the healthcare system. So this places everyone in the same camp for knowing how to access a situation and where to bring them. So make sure, mom and dad, that you know who and where is your pediatrician, know who and where is your family doctor, know where the closest 24/7, know where your closest ER is, make sure everyone has their telemedicine app downloaded, and who to reach out to if you have an issue or a question. If you have a healthcare advocacy line or someone to call, know them. If you're on a direct primary care, have those people saved on your phone. Make sure that that information is accessible to everyone. And you probably want to make sure that that information is accessible just somewhere public in your house to an extent. Because if you've got babysitters or grandma and grandpa are over, you want to make sure that they also understand the game plan. You can tell them where exactly to go. They will be able to know what your policy numbers are, what your group numbers are, your IDs, all those things, and where they should take the kids if there's a quick emergency and they need to move really fast. So create a family how-to plan, make it safe, be on the same page for the whole family. Tip number 9 is, if you have an HSA, set up your contributions. So I'll be the first to admit I'm not a fan of high deductible health plans. Yes, they are usually the cheapest payment, but they have the worst plan contributions. So this means that you are signing up to pay nearly everything out of pocket until you hit your deductible. So if this is you, you need a plan. Since you have a high deductible health plan, which high deductible health plans are not actually determined by your deductible per se, they're listed as a high deductible health plan. It's how the plan is structured. It includes the deductible amount, but it's more about how actually you go about paying for things. Sorry for the side note, but you will need to set up contributions either with your employer or with whatever HSA vendor you have if you're self-employed. You can still set up an individual HSA. Lively is a good one. They're free to be able to use them. So the goal should be, though, that you want to cover your entire deductible amount in your HSA account. So that's kind of the gamble that you take when you have an HSA eligible account, a high deductible account, is that you're expecting that you will have minor expenses during the year, right? So you're not going to have to really pay much. That's why you're taking the lower monthly cost, and you're doing it so you can build up your HSA account, which is cash, right? So this means that moving forward, if you were to build your entire HSA account, so say you're on a $5,000 high deductible health plan, this means, okay, if I save up $5,000 in my HSA, going forward, if I do a high deductible health plan, I always have this $5,000, which will cover my deductible expenses and kind of keep costs low over the course of time. At least that's what it is in theory. I know people use it for tax deductions and other things like that, and which you can. There's benefits to the tax side of things, but as an insurance consultant, my concern is more about you getting the actual care you need and not having it bankrupt you. If we're going to be honest, most people don't have, right, $5,000 laying around to cover their deductible. So an HSA, high deductible plan, you're paying everything out of pocket until you hit that deductible. So if you're prepared to do that and that's not a big deal, then go for it. But if $5,000 is out of reach for you, you really might want to consider not picking the cheapest option, but seeing what's actually most valuable to you, because you don't want to put yourself in an issue where essentially you are functionally uninsured, meaning that you have health insurance, but you can't use it because you don't have the funds on hand to do that. So think through that. Don't just pick the cheapest one. But if you do go the HSA route, then absolutely contribute to it, or there's really no point in having an HSA account. All right. Last one. So, tip number 10, buyer's remorse. So, if you have a plan that you're not satisfied with, so if you've signed up for something and you realize it was the wrong fit, I want to be able to give you hope. You can make a change. Contrary to popular belief, you can, in fact, leave your health plans. There are ways to cancel your plan. You can make that change. And if you did the previous 9 steps that we talked about, the other tips, and you realized a handful of things that you're paying too much, that you have poor benefits, that you don't have an advocate, then please reach out to us here at Imago Day Insurance Advisors. We can recommend some of the best plans in the market right now. So if they can beat your employer's offering, why not make that change? Or if you're on an ACA marketplace plan and you hate it, you can also make that change. So let's strive this year, in this new year in 2025, to continue to get 1% better, to take those little steps that can make a tremendous impact for you, for your family, and how you're going to help manage your healthcare and your healthcare spend in 2025. If there's anything that I can help with, please reach out to me at any time. I'd love to. Thank you so much.